Okay, we're continuing with the book here, Prevent and Reverse Kidney Disease by me, Pete Rogers. Okay, we're talking here a little bit more about Papua New Guinea. So in Papua New Guinea, they were eating 93% of their calories from sweet potatoes. And sweet potatoes are great food. A lot of people, including Dr. McDougall, think they're the best food in the entire world. They've got only 1% of calories from fat, so that gives you good blood flow, makes you skinny. They've only got 4.5% of calories from protein. It's like the lowest amount of protein in any of the starches. And that's what you want if you're trying to protect your kidneys, is a really low protein diet. And even more when you talk about a kidney failure patient, especially if they're towards the end stage kidney failure, when their GFR gets below 30, they might need to be on potassium restriction. Maybe not, maybe yes. In general, starches have less potassium, certainly, than fruits do. Okay, so they're a great food. Let's see what else. They're also fit and strong. It's part of the message that you really don't need hardly any protein. Okay, why is albumin such a big deal? Well, your blood albumin, it's a real important protein. It maintains oncotic pressure in your blood so that your blood doesn't just leak into the capillaries, which it would do if it was too hypoosmolar. Albumin is a small protein. It's got a molecular weight of about 69 kilodaltons, just big enough that it doesn't get filtered much through the glomerulus, the filtration part of the kidney, the nephron. The small size of albumin makes it vulnerable to being filtered into the urine if the glomerular membrane is leaky. Albumin has a negative charge on it, a zeta potential, just like red blood cells and endothelium have. The negative charge also helps to repel it from being filtered. Okay. But anyways, looking at that blood level of albumin is real key to see how you're doing with the diet. So here's just a couple papers to show you there's some research behind this, as well as all the clinical experience of Dr. Kempner, for example, Dr. McDougall, and many others. Keto analog, supplemented, vegetarian, very low protein diet, and CKD progression. Prospective randomized controlled trial compared with a low protein diet. Endpoint was renal replacement therapy or greater than 50% reduction in initial GFR. And so correction of metabolic abnormalities occurred only with the KD. Compliance to the diet was good with no changes in nutritional parameters and no adverse reaction. Thus, the keto supplemented diet seems nutritionally safe and could defer dialysis initiation in some patients with CKD. So they always make their conclusions sound kind of wimpy, but it's been known for a long time. Low protein is the way to go, especially very low protein, and they might need keto analogs. Okay. Does animal protein cause hyperfiltration? Yes, it does. And it overworks the kidney. It's like making the kidneys work double shift or triple shift, and that accelerates the rate of progression towards chronic kidney disease and total renal failure, ending up on dialysis, end-stage renal disease. Okay, here's another paper. Effects of restricted protein diet supplemented with keto analogs on renal function. Okay, restricted protein diet with KAAs for keto analogs significantly preserved glomerular filtration rate and reduced proteinuria. Also reduced serum phosphate, parathyroid hormone levels, systolic blood pressure, diastolic blood pressure, and serum cholesterol. So everything good was done. Very low protein diets with keto analogs are plausibly superior to low protein diets in slowing the decline of GFR, glomerular filtration rate, how well the kidney works. So conclusion, restricted protein diet supplemented with keto analogs could effectively improve kidney endpoints, including preservation of GFR and diminishing proteinuria. That's all great stuff. And lowering blood pressure levels. VLPD, very low protein diet with keto analogs appears to provide more effectiveness in slowing the decline of GFR, lowering blood pressure, and reducing serum PTH, and less so for increasing calcium level. Okay, well, that's not as high a priority. So another paper showing benefits of the very low. Here's another paper. Economic analysis of keto analog supplemented very low protein diets. This one's in Taiwan and Thailand. A keto analog supplemented vegetarian diet, so SVLPD, supplemented very low protein diet. Support dietary intervention using keto analog supplemented very low protein diets to prevent CKD progression and postpone dialysis as a cost-effective approach with beneficial effects for patients. Okay, so the point is there's tons of data on this in terms of like the work that's been done from people like Kempner and whatnot, and more papers are accumulating, but nobody's that eager to do those papers because, if you slow patients going to dialysis, the nephrology business doesn't make money off them. But I can tell you, I can assure you, if I had kidney failure, I would do everything possible in my power to minimize that dietary protein level. I would check my blood albumin levels, check my potassium levels, and as long as they're doing okay, I would continue as I was. If I'm maintaining my serum albumin and I'm not accumulating potassium, I would just go with it 100%. If I started accumulating potassium, then I'd have to find a lower potassium starch. And if I started dropping my serum albumin, then I would maybe have to supplement with keto analogs. And you would need a good nephrologist or a good dietitian like Jen Moore or something to work with you. Be checking your blood levels and analyzing them until you. So, anyways, I hope you found that helpful.